Welcome to In My Own Words, presented by AARP Georgia. I'm your host, Deborah Tyler Horton, AARP Georgia State Director. For the next 30 minutes, we'll take a look at the careers and journeys of individuals who are disrupting the aging process and living their best lives. We hope you will find these conversations informative and inspiring. Stephanie, great to see you. It's been a while.
It's so good to see you. I can't wait to lay eyes on you in person down in Georgia.
Yes, I am looking forward to the day to be able to get back on the road. You know, I appreciate you taking the time from your very busy schedule to talk about the work you're doing as it relates to African Americans and Alzheimer's and their caregivers and the additional burden and concerns during COVID-19. So let's just jump right in. Let's
Okay.
start with you sharing a little bit about yourself and how you became the executive director of Us Against Alzheimer's African American Network.
Well, thanks so much for that. I'll try to limit my comments. I love talking about my work and I love talking about myself. So those are two good topics. But I grew up in Baltimore, Maryland. Went to school in state, and was really have always been interested in health and in civil rights and education, and equity issues. And after I had spent about 25 years working in Washington on Capitol Hill, I retired from the federal government and was introduced to Us Against Alzheimer's, in fact, as it was in the process of forming. So I joined with them, learning a lot about this disease that, despite having worked in a health environment in Washington, I had never become very aware of. In fact, I often say that no one had come in and really talked to me about health disparities. I guess they weren't a thing back in the early '90s. I know that they were, but we weren't able to really talk about it. So I joined this organization. Quickly began to understand and discover this really significant disparity between how white people responded and were developing Alzheimer's disease in Blacks, and was just, went in deep on these statistics and discovered that, although Blacks were 13.4% of the population, that we were 20% of the people who had received an Alzheimer's diagnosis, and we think that's an undercount. But we were certainly bearing at least 33% of the national costs of this disease. A lot of those costs were not healthcare costs, they were costs that families were bearing and having to leave the workforce to care for their loved ones or bring in caregiving supports that were needed for this very long journey. We learned very quickly that Alzheimer's disease in African Americans was certainly very present. But that we were very reticent to get a diagnosis, that there were a lot of myths associated with it. We called it sometimers disease. Sometimes you remember, sometimes you didn't. There was a lot of that going on in our community, and they felt that, aging and memory loss was a normal part of aging. So we really had to start at the beginning, talking to people about the symptoms of the disease, which we know now that the brain can start to change even 20 years before you first get symptoms. So wonderful information, because now we can direct our treatments as they're being developed to hit people before we begin to experience those significant symptoms, which is Alzheimer's. So that's sort of how I got my start and formed the African American Network Against Alzheimer's, and been traveling the country, talking to people in their communities, bringing resources to them, and trying to engage churches and civic organizations and fraternities and sororities around raising awareness about the disease and what people could do, what they could be empowered to do to promote their own health and the health of their loved ones.
Well, Stephanie, I know the work that you're doing is so important. It's critical to our communities. And now, how long has the organization been around?
So Us Against Alzheimer's, which is the parent organization, has been around since 2010.
Okay.
The African American Network, we came into being around 2013. We actually launched at the Congressional Black Caucus Foundation leadership meeting in Washington, D.C. We were joined by Reverend Al Sharpton and Dr. David Satcher, former Surgeon General of the United States, as our two prominent co-chairs. And so very early on, we began to speak about this issue as a social justice issue, as
Mm-hmm.
a health equity issue, as a civil rights issue. If you don't have your health, you can't take advantage of employment and other opportunities that exist through all the hard work through the civil rights movement. And if you don't have your good health, and you're spending all of these resources, sometimes caregiving costing upward to $10,000 a month. Many families are just not prepared to absorb that. And first generation college grads coming out of those families, sometimes it's too much to bear, the sandwich generation, and taking care of your loved one, your parent, your grandparent, can wipe out the benefits that we have all benefited from as a result of civil rights in one generation. So we began to speak very earnestly about why we needed to act now, why we could not wait.
Right. It is so important. And as you mentioned, caregiver, I want to dive a little bit deeper into that in a few minutes. But before we do that, can you talk a little bit more about um, the necessity to have an organization that focuses solely on people of color? Do you find that African Americans, other people of color, are reluctant to test for Alzheimer's and other diseases as they relate to brain health?
Well, a lot of people don't know that that's something that should be tested. And I'll just tell you my personal experience. After coming to work at Us Against Alzheimer's, my father was later diagnosed with Alzheimer's disease. And when I began to express concern about his memory, his behavior, how he seemed to be becoming a little bit more withdrawn than usual, and of course, forgetful. We went to the doctor, we asked him about it, and the doctor made really every excuse. And then I asked him, I said, well, what about Alzheimer's? Do you think that's possible?
Mhm.
And he answered me by saying, well, if it were, why would you want to know? We don't have any medications that can change that. And I said,
Right.
well, if I had breast cancer, if I had a lump, and you didn't think it was something you could operate on, would you just ask me why I would want to know? I have a right to know. We have a right to make plans for my dad. We have a right to think about the future. We have a right to get our, the will in place. We have a right to begin to think about caregiving and those resources and his ability to work and his ability to drive. I need to be empowered to make decisions with my family about this. And by the way, you're fired. And so we found another doctor
Absolutely.
who was more
Absolutely.
willing to engage us where we were. And he now receives excellent care. He's had this disease now for about 9 years, and he's doing very well in terms of his disease progression. But, it's extremely challenging. And to have a medical system that doesn't even want to talk about it, and to a degree, I understand it. The medical system likes to be able to offer you a quick solution in many cases, or a pill that you can take, or an operation you can have. And in this disease, unfortunately, we've got some good management of symptom medications, but there's nothing yet that can change the trajectory or stop it from progressing or cure it. So that was really, really very important to do that. So
I think,
empowering families with the information that they need to know. Number one, that they need to understand that this isn't normal. Normal
right.
parts of aging, you can have some, forgetfulness, and that's different than memory loss. Memory loss where you can't force recall, where it's not just because you're distracted or you didn't get a good night's sleep. The memory is gone, and it's a memory that might be gone as something that you have done routinely, like you forget that Wednesday you take out the trash. You've been doing it for 20 years. You can't remember how to get to church. Lack of recognition of people's faces, being able to recall people's names who you have a lot of contact with, or family members. That's very different from a memory, a simple memory impairment that goes away.
So, Stephanie, you said something I think that was very, very important. You talked about fear, people being afraid of understanding or knowing what's going on. What are some of the things that your organization is doing to help combat that fear, where people can have those conversations? What are some of the things that you could say to our audience right now that says, if you're concerned about, these are some steps that you should take?
Well, we know that, and that's a great question. Most of our work, frankly, in the field, because we are a national organization, we leverage partnerships like with AARP, both at a national level and at a state level, because we know that routinely AARP is very focused on caregivers, has excellent resources that we proudly take to a lot of our events and distribute then. And they're meeting with people and they're talking with people through their networks, and so we leverage the networks that we know that Black people respect and Black people participate in. So we often will partner. We've partnered with 100 Black Men of America, National Black Nurses Association, National Medical Association, the links, the sororities, fraternities, the places where we know, barbershops, beauty shops, regular places that we know, that we tend to go to and where we trust. And of course, the church is a big trusted element. We've often, when we're in communities, partner with the pastors and talk to them. One of the interesting things is that as our pastors nationwide are aging, they're also experiencing Alzheimer's disease in a personal level. They feel that they don't have anyone that they can go to and talk about it, because that they feel like that admits that they've got a deficit. And so really encouraging people by talking about this issue, it helps deal with fear once you understand that you're not the only one who's going through this, and that there are things that you can do to manage symptoms. And we know that tips about modifying risk, which we've learned very recently, can help prevent and forestall the onset of Alzheimer's disease. Things like, eating well with good nutrition and hydration, and moderate amounts of aerobic exercise per week. Things that you can do through walking and using cans to lift weights. Things that you don't have to go out and spend a lot of money to do, but just being mindful of movement, mindful of learning something new, mindful of not just watching television, but engaging your brain. Learning something new like a puzzle, or I learned how to paint with watercolors during COVID. Legos are next. Just doing things that are different, that are accessible, that all of those things can really help. And families, are empowered by, but of course, it's aging in and of itself is fearful.
Yeah.
Anytime that you think you're going to be losing your independence is a fearful thing, and it's a very humbling thing. And we all have to understand that we're all going through this together. We need to rely on each other. We need to be honest with our family members so that they can provide support as needed. No one's trying to take away your rights. We just want to make sure that you have the skill set and that you have people around you who can help as needed. So giving people permission, we call it coming out of the shadows, to talk about this disease. It's not a disease of just the poor. It's not a disease of just the rich or the famous. More and more people are admitting, B. Smith and others who've come out of the shadows and admitted that they have developed Alzheimer's disease, empowers all of us to say, really, me too, me too.
Yes, and you touched on some things, and one of my questions was going to be, because I think as people are listening to this, they're thinking now, how do I prevent from getting Alzheimer's? And some of those things, the tips that you talked about, keeping the brain healthy, activities. Do you want to add anything else to that?
Well, there's a lot, again, that we can do. And I think AARP, at many of your events, you provide, I recall, you have produced a cookbook. American Diabetes Association has one that specifically has good soul recipes. So they're, just slight modifications in our diet. I wouldn't say you've got to, adopt a diet that is all fruits and nuts and grains. That's not really realistic. A lot of folks want to attend their fish fry dinners and Sunday in church. Things with modification, I think, can be really helpful. But one doctor told me something that I thought was very helpful is when you look at your plate, just make sure there's lots of color on the plate.
Yeah.
And that pretty much ensures that you're eating a more healthy diet with fruits and vegetables. Try to not, fry things in heavy fat. We know that we can use, these air fryers and other techniques that can help reduce our fats and not necessarily reduce the flavor. But, we, I think, are really blessed at this time in our heritage that people are speaking and producing items for us that are much more healthy. We also know that there are comorbidities that come alongside of Alzheimer's disease that, in fact, can predict unfortunately, the likelihood that a person might. And those would include vascular conditions, heart disease, high blood
Mhm.
pressure, diabetes, all these things where Blacks are at least twice as likely to get as others,
Mhm.
can be modified using the same kinds of tips that will help modify the ability of us to, not have Alzheimer's in our family. And so, generally, just a healthy, active lifestyle as much as you can will help with those things, and making sure that those other comorbidities are being treated. So getting to the doctor early, making sure that you're taking your blood glucose levels, and that you go in for regular routine care and prevention care. We know that women, frankly, 60% of women are the ones who are making a lot of these decisions in the home. Women are also the caregivers for most of the people in their families who develop Alzheimer's, and they also are much more likely to develop Alzheimer's. Two-thirds of Alzheimer's patients are women. So we're
Mm.
getting a triple whammy here. And so women in particular, we view us leading by example, making sure we're taking care of ourselves, even if we're trying to take care of everyone else in our family. But making sure that our men and our sons go in for those routine visits, because they are very reticent, it seems, to go in for prevention. And we, unfortunately, and I'm not speaking about just Black Americans, we don't do a good job in this nation of practicing prevention. We go in for emergencies. We've got to make sure that we're going in to prevent some of these illnesses that are preventable or that are treatable, and make sure that we are following what the doctors are telling us to do with them.
It's definitely, thank you so much for that. And AARP, for our listeners, if you can visit www.aarp.org/GA and get more information about the things that we're doing here in Georgia. And visit our website and see the resources that are available. Stephanie, let's talk a little bit about the caregiving aspect of this.
Mhm.
And especially during COVID-19,
Mm.
it creates a whole new layer of barriers for our caregivers. And as you mentioned, you partnering with AARP, and we have resources for caregivers. But can you tell us a little bit about some of the resources that your organization has, and how people can access that information?
Absolutely. So one of the things that I think was a big challenge was when we began to be shut in with, as a result of COVID and the pandemic, is that we saw places where people would frequently go for help also close. We saw people who were in nursing homes, in assisted living, not being able to access adult day centers that people had been using to stay active. They weren't able, many people, to go out to their routine physical appointments. A lot of the exercise programs that people may have been involved in also had closed. Caregivers who would come in a lot of times to provide respite opportunities for the family caregivers who were in place, they were shuttering in place. So we really saw a breakdown of the system. And on top of that, we saw Blacks and Latinos in particular having significantly higher rates of COVID and COVID mortality. So I think the pandemic really shed a light on what we need to do as we're talking about building better back, the Biden administration's different proposals, that we have an opportunity to make sure that if we face something like this again, that we have in place methods and methodologies that will allow the people who are doing caregiving to get the supports that they need, to get the respite that they need, to get the skills that they need, that people who are coming in and tending to our loved ones are getting the medications that they need, they're getting the screenings that they need. I mean, we need to do all of that and more at the same time. Us Against Alzheimer's is primarily an advocacy organization. And so we were really, and still are, laser focused on the choices that caregivers, especially caregivers of people with Alzheimer's, have to make. Oftentimes, having to make a difficult choice of work versus care.
Mhm.
And it's a choice that no one should have to make. No one should have to face choosing between their loved one, whether that's a child or an adult loved one, and potentially losing their job. And so proposals in Congress that would support paid leave for folks who are employed have become really a central focus of our organization as one way of ensuring job protection and resources that families need to be able to keep above float and to be able to make sure that their loved ones are getting the care that they need. And recognizing that as these caregiving centers are closed, that people are going to become increasingly reliant upon family. And right now we're the only industrialized nation that does not have a formal paid leave policy for individuals. We don't have a national requirement even for paid sick leave. So we're focused on that. We are working hard to make sure that the adults are included as part of that conversation. It's a difficult uphill climb, as we also recognize that employers are facing challenges. They were facing challenges with their businesses closing and things of that nature. But we've got to take a stance on this issue. We've gone too long, and we're hearing just horrible stories about people going on welfare, people becoming homeless simply because they don't have a job, they were laid off, or they're being told, you can take off all the time you need because, by the way, we're not going to have a job when you come back. That can't be America. And so we're lobbying hard to make sure that happens. And if you want more information or to join our advocacy efforts, you can go to usagainstalzheimers.org and learn how you can participate in some of the policies that are being developed to support caregivers and to really help us where we need it and when we need it.
Thank you, Stephanie. This has been a great conversation. We're going to take a break, and when we return, we'll continue our conversation with Stephanie Monroe, Executive Director of Us Against Alzheimer's African American Network. And we're going to talk about lifting of restrictions, allowing us to visit our loved ones in nursing homes, but also going back to the doctor's office. So stay tuned.
What would you call a joy that knows no bounds? That is as solemn as it is sweet, with an outpouring of soul that connects us. Joy in resilience, joy in creativity, joy in happiness, joy in strength. What would you call a joy that knows no bounds? A joy supreme. AARP celebrates Black joy. Visit us at aarp.org/Black community.
Welcome back. I've been chatting with Stephanie Monroe, Executive Director of Us Against Alzheimer's African American Network, talking about the challenges African Americans face as it relates to Alzheimer's and how caregivers are coping during COVID-19. Stephanie, we've had such a great conversation, and I want to take a moment to just visit the point of the lifting of restrictions. So we have our loved ones in nursing homes, and now that they're starting to open the doors so that we can visit again. But we also need to be able to not only take care of our loved ones, but take care of ourselves, the caregivers. So can you talk to us a little bit about what you see about the lifting of restrictions for caregivers as well as their loved ones to go back to doctors' offices?
Yeah, this is such a real problem, and also one that I've personally experienced with my parents who live in an assisted living facility. It's been really difficult as a caregiver to not have that kind of access to them, to be relying on a facility that's been challenged due to COVID, on caregivers who weren't screened every day. I didn't know if they were coming in and taking care of my parents and that they had the disease or not. Like I said, we did not have a consistent, and we don't have consistent policies state to state. It really is up to states, and then it's up to counties, and then it's really left up to the actual facilities that these our loved ones are in. So it's been a real challenge, and we know that there's been very high depression rates among caregivers, but also very high depression rates due to social isolation of people who are actually being cared for in these facilities. They have a lot of questions. They've got medical needs that haven't been able to be focused on in a personal manner. We've been able to do with some success, televisits, but it's hard to get your blood drawn over the phone
Yeah.
or through Google. So one of the first priorities, I think, as things are loosening up is, yeah, absolutely. If we can get that FaceTime safely, if we've been vaccinated ourselves, if we've made sure that our parents have been able to get vaccinated, then we should feel free to come over and schedule in-person doctor's appointments to the greatest extent possible. And if not, we've got to make use of the televisits just to make sure and to do a check-in. My dad has comorbidities, as I mentioned, diabetes, high blood pressure, vascular issues. We had a couple scares during COVID with a concern about circulation and, bruising. And, for diabetic, that's really a concern. And I'm not 100% sure that we got the best medical care at that time because of the way things were. And so this is Minority Health Month. I've got 4 visits scheduled for my dad and my mom, and I'll be spending some time making sure that they are attended to that way, and I get to see them face to face in the process.
Well, Stephanie, thank you again. It has been an absolute pleasure catching up with you. Can you give your website information for our viewers? If you could share that information on how
Absolutely.
they could reach out to you.
So to reach us against Alzheimer's, you can go to our website, which is www.usagainst-alzheimer's.org. We also invite you to use a new tool that was recently previewed on Good Morning America about a week ago. It's called the Brain Guide, and it's a simple assessment of your brain health using words that you would have to remember and recall. I've done it a couple times. It's actually fun. And at the end, you're given access to information about whether you need to see a doctor or suggested or other resources that you can use. To access that tool, and it's free, 1-855-BRAIN-411.
Thank you, Stephanie. Again, thank you so much for your time, the work that you are doing for communities of color. We know you are one of the busiest people I know that's out there doing this great work, and we want to stay connected and continue partnering with AARP. For more information about what AARP Georgia is doing, please visit www.aarp.org/GA. Thank you for joining us today and stay safe.